Welcome to What the Health, an independent approach to your health span. Have you noticed how our healthcare system may not have your best interest in mind? Join Dr. Eckel in this fun and sometimes disturbing exploration of the state of healthcare and what it means for you. Now, here's your host, Dr. Eckel.
Welcome back, everybody, to What the Health. I'm Dr. Greg Eckel.
Dr. Jonathan Nadal.
We're coming at you from the headquarters of Nature Cures Clinic here in sunny downtown Portland, Oregon today. So, Dr. Nadal, we are on this lovely trip down longevity lane, and just in the last 5 to 7 years, we actually have changed the tune and changed the game here, where we have dubbed aging as a disease.
Right.
And with that classification, it's not just for grown-ups anymore. Aging as a disease has changed the mindset of how we go about correcting that and addressing it and treating it. And what we're seeing clinically is we actually are able to show some biologic markers that are reversing aging, in that we can, but then there's this dilemma of, well, how do you measure that, right? Besides just looking in the mirror and looking to see how you feel, or maybe if you remember like calisthenics class from middle school of the presidential challenge. I don't know if they had that when we went through school. Now I'm dating myself. So, the components of, we have telomeres, we have all kinds of methylated DNA clocks. Let's dive in here on some of the measurements and some of the thought leaders here. We've got Steve Horvath from UCLA, who came up with the Horvath clock. He's kind of the world-renowned expert in developing these clocks. So aging clocks, what does that mean, right? I know what my dad tells me about birthdays is it's better to have one. It beats the alternative, right?
Sure.
in simple dad math, which is awesome. Love you, Dad. And then we have methylated DNA. So this is, methylation has been a hot topic in alternative complementary medicine. Now it's kind of coming into mainstream medicine, but we're not talking about methylated pathways. This is methylation on the cell that you can measure how old your cell thinks it is. So the biologic age. Now, just to keep that simple, I'm sure you've come across somebody who is the same age as you, and they either look way younger or way older. It's always nice when they look way older, right?
Yeah, totally. Because we're doing the work. It's nice to feel
right.
Like,
okay, I'm doing something here.
Mm-hmm.
But the component here, there's ways to measure how old your immune system thinks it is, how old your cells think they are. So there's a component of immunosenescence and senescent cells, which are kind of like zombie cells that get turned off after a certain amount of replication. We have the Horvath Grim Age clock. So with that,
I think of the name.
I know, Grim Age. It actually can predict when you die. Uncannily so. So, we can talk about the ethics of these clocks. Like, do you really want to know that? But also it's a measurable, which means if you're measuring it, you can change it, which is what I like about them.
And it's partly what we're doing, right? Even just to briefly go back to what you were saying, like aging now is a disease. Well, how did that change? Why? Well, because we realize there's so many components that contribute to it that could actually be changed and prevented. So it's like, as the scientific community is unpacking it as something that's actually actionable, and to figure out what we need to do is what we're talking about here, where we can test it, right?
Yeah. So I had the pleasure of going to a lecture, Dr. Steve Horvath. He's a really pleasant guy, very brilliant. After 3 hours of lecture talking about the different algorithms and what goes into the measurement and how they're calculating this out. And these clocks work on like every species on the planet. So it's taking DNA methylation, which is a detoxification pathway for our cells, but measuring the pathway on that. 2013 paper, he said, these are quotes, "I propose that DNA methylation age measures the cumulative effect of an epigenetic maintenance system. This novel epigenetic clock can be used to address a host of questions in developmental biology, cancer, and aging research." Well, do we need to unpack any of that?
Sure.
How do you describe epigenetics? Because we actually just got asked this, I believe, yesterday in the procedure room.
Yeah, exactly. I mean, so if you think epicenter or anything with the root epi in it, it's like the main or above, right? So kind of above genetics or at the heart and root of genetics simultaneously, right? And these are the changes that can happen or that do happen while we're living. It's day to day, night to night, what we were born with versus what's being changed after the fact. And it relates to those kind of on and off switches when we mention methylation. That relates to a lot of it. So if you picture that beautiful DNA spiral, at the end of it, there's different ways of kind of capping it off and telling it to keep going or to stop or shift. And that's what the methylation is referring to in essence, right?
Yeah. I love it. Yeah. So that component, once we start talking science, right? So we see you out there in podcast land glazing over, but stick with us because this measurement, we need some of these objective data, because what this means is by coming up with an accurate clock, if we can reverse your age, reverse it by 7 years, if we did that planet-wide, 50% of all chronic illness would go away. 50% of all chronic illness. So this is no small discussion here. And this is one facet of it. So, DNA methylation, you said it really well. It's the epigenetic mechanism. So above the genome, it's about throwing switches of your genes on and off. Again, we've talked about genetics a couple times in this longevity vein, where just because you have the gene doesn't mean you're going to get the condition, right? 20% of the time, given all of the same factors, you'll express the gene the same way. So there's that, but this is the modifying. There's a methyl group put onto the DNA that modifies the expression of your genes in a pro-aging or anti-aging. I guess we could say pro-aging would be age reversal. So should watch those terms there.
Yeah.
So that's one way are these clocks. Now there's another way, which is the way that I learned, which was the older way, is the telomeres, right? Mm-hmm. And these get described as, like the plastic at the edge of your shoelaces. When that comes undone, the shoelace is worthless. But it's how long that, so to speak, plastic cap is. When the cap runs out or disappears, then your cells can't replicate anymore. And then presumably you die because there's no more replication of your cells.
Right. So
that's the telomere length is another way. It's not as accurate. It's not as transferable interspecies wise. So it's not as universal. I still think it can be a valuable marker to look at. But not as much as the methylated DNA.
Yeah, that's definitely the more up-to-date. It's a little more accurate. And both theories can inform and support each other, but definitely I'm more a fan of the DNA methylation now.
Yeah.
There's so much coming out.
And looking at it. And so then ideally, none of those matter, right? Is the first tenet of longevities don't die. If you're not living a life worth living and or having the energy to it. So we look, of course, at functional measures. What are some of the things we can look at functionally for folks as far as longevity markers?
Yeah, there's a whole lot. I mean, there's different labs that we run. Some of our favorites, we also like to track like heart rate variability, things like VO2 Max, and even more in-depth, the carotid intima media thickness. That's huge too, especially with how rampant cardiovascular disease is out here in the West. So,
right. So let's talk about a couple of the functional components. Heart rate variability. What is that?
Well, that's a really interesting concept that I'm surprised that it took so long to develop in medicine and exercise physiology and all that. Because, back when you thought that you had to run for an hour every day to do cardio, and that was the fastest way to lose weight, now we're realizing that heart rate variability and like things like high intensity interval training, your heart needs to be able to shift up and down. That's more of a marker of it being strong and healthy. Essentially for it to be adaptable and for it to vary in its output and input. So it's huge. Like that flexibility, think of it, kind of is a heart, a muscle that is, but the same flexibility and strength that you would imagine your body having, and that means strength and health and mobility, is the same thing that we could assume with the heart, where it needs to be flexible and adaptable and variable, and not just pound for whatever days that you have.
It's interesting. I was going to research some techniques around deep breathing to reduce blood pressure. And then you get in the research and literature on blood pressure, you realize, wow, it's very variable, right? So why you have to have 3 successive readings on different days to get a diagnosis of hypertension is one reading, and there's a variability of the blood pressure, which we think it's super stable, 120/80 all the time is my blood pressure. But heart rate variability is measuring the peak to peak, like you're saying, the beat to beat, that we want to have a very large, or the higher the number, the better, which represents tone on our nervous system, in our parasympathetics in particular, which is our rest and regenerate. So there's sometimes some confusion around heart rate variability and what it means. You can't compare, yours to mine. It's very individualized. My brain always wants to do it because I tend to run on the lower side of heart rate variability when I'm comparing. We do compare, not on whose is bigger, but on what, on heart rate variability. That's what I'm talking about. It is around, how are you healthy or not? And do you have tone on your parasympathetic nervous system? And so it's very healthy. It's a sign of health. So the heart rate variability, I'll stop harping on it, but it is, it's a great measurement. I do mine on the Oura Ring, the iWatches, the Fitbits, the Garmins. All of these devices are doing HRV testing. There's some apps for your phone that you just put your finger over the camera. So there's a lot of different ways to check in on that. Heartmath.org is one website. They've done a ton of research on heart rate variability. Great group. And really, I really like them. I've had patients, get little clips that they're watching their heart rate variability. You can do training on it. Things that increase heart rate. I said I was going to stop harping, but I just can't. I love heart rate variability. Is, high intensity interval training, cardiovascular training, etc. So, yeah.
And even just to mention it, even we have this, remember the Wavi device that we run with people, which is for brain waves and conductivity and essentially what your brain is doing with all these leads, but we can also check the heart rate variability with it. So that's a fun tool to have, because we know, EEGs and overall brain executive function is going to be important too as we age. And we here's a fun fact. Under stress, right, and traumas, there's capital T trauma, little t trauma. Capital T trauma are the big ones, like deaths and physical abuse, witnessing traumatic events, living through hurricanes or natural disasters. And little t traumas are not to be belittled, because they show up the same way in the brain, of shrinking the prefrontal cortex and enlarging the limbic system. So by measuring what your tone is, it's a great longevity marker in addition to some of the other objective data there. I just felt like I wanted to share that with them. Yeah. No, wonderful. And I feel like you hinted at it, but in the realm of that also, that's why vagal tone is also important. in that regulation of parasympathetics and sympathetics. And
Yes.
there's other videos and information on that out there. We do an amazing voice scan that can read the vagal tone even remotely for patients. So that's another important one too.
There is another great one. One activity. This is one that you can try in your living room. Just make sure you move all pointy objects away. Is getting up and down from the floor without using your arms. And that's worthy of about 7 to 10 years of your life as a longevity indicator, which is really checking your core tone. And so being able to, and there's some, I think it's 10 points, and you lose points if you wobble, or if you use an arm, or you have to balance yourself. But it is actually quite tricky of getting up and down from the floor without using your hands. So that's number one. And that's a functional medicine test, in that it's very practical, because you're going to be less risk of falling, better coordination, and better core strength, which all leads into a good longevity marker for you. So that's one. Number two, VO2 Max. This is volume of oxygen maximum intake or absorption into the body. And this is the gold standard. It's better than, if your cardiologist has that in their office, that's awesome. They're in the top 2% of cardiovascular labs in the country. We have access to one of these devices as well. And it's checking microvasculature changes in the body. So before it becomes macrovascular, meaning, carotid arteries that are clogged with atherosclerotic plaque, or narrowing of the arteries because of those plaques. So it's looking at microvasculature. And when you think about it, or think it through, it's like oxygen is life. We're going to talk about oxygen therapies later in today's show, but it's also measuring. So you get a full 12 lead EKG. So looking at the conductivity of your heart, the electrical activity of the heart, and then you're wearing a mask and you just push yourself. It's about a 20 to 30 minute test. It accelerates in resistance, and you're really huffing and puffing through this mask. And it's looking at the compensatory, like your blood pressure in response to strain and load on it, to how much oxygen is actually being absorbed in your system, which then represents your microvasculature nature. So I tested 9 people last week on the VO2 Max bike. 7 of the 9 people, myself included, who I consider myself physically fit, are exhibiting microvascular changes. So this means if I don't change anything, I will develop cardiovascular disease on a macrosclerotic point in 10 to 15 years, possibly sooner, depending on what my cholesterol is and what my sugar levels are and hemoglobin A1C. So it is the gold standard on a longevity factor. And it makes sense intuitively, and also in the research in my brain, where you can then really measure performance and then this microvascular component. So
amazing. Yeah.
Yes. And it's based on your age, your height, weight. So it's predictive index for healthy male or female of your age group, what your expected oxygen carrying capacity would be. Now, of course, you want to be 100% or better. Thankfully, I was up there. I like to be an overachiever in some things. And that's one of them that we like to do. But so that is a great functional medicine test.
Yeah. And you know what, just to mention, it's a reminder that the heart, it's not a closed unit. It's not a closed system. I think like old school anatomy, physiology, you're meant to do it. And sure, fine. But at the end of the day, I mean, all of our muscles, all of our tendons, ligaments, and nerves, like as blood is moving in and out of our body, all of that microvasculature, capillary beds to venules and arterioles, all the way up to big arteries, are all a massive part of the heart. So it's more like the blood goes into the heart, swirls, and then is redirected where it needs to go. So the whole body is the pump. for the
Right.
heart, and that doesn't just stand on its own. So
Yeah.
that's why the VO2 max and just assessing more that microvasculature, it's very telling that we need to have a whole systems approach and not think of things so.
Yeah, great point. Great point. And just bringing the Chinese medicine into this discussion, we talk about Chinese medicine really be affecting the blood and the quality and information in the blood. And really, like if we cut the blood flow off to my finger, what would happen to it, right? It would turn, blue to white, to purple, black, maybe in that order. And eventually, though, it would fall off, right?
Right.
Because that's how important blood flow is. So the blood carries the healing properties of the body. So that, to me, looking at VO2 max and that performance component in microvasculature health is very, very important for us. There are some other markers in the blood that we look at, though. So what else can we add in here as far as measurements? Because, if we're going to really treat aging as a dis-ease and grow younger next year, there are some, annual, semi-annual, quarterly panels that we recommend for folks.
Yeah. Well, as you mentioned before, obviously the hemoglobin A1C, right? Just making sure that that's checked off.
What is that? What is that?
So essentially, if we think of like if you run a lab in the morning and you just check the glucose, or even if you do a little blood stick, that's like right then and there, all right, the amount of sugar in your bloodstream, right? But if we take it up to the next level, the hemoglobin A1C, if we think kind of what's flanked or hanging out with the red blood cells that's marked off with those sugar molecules over the course of about 3 months, it's more of a broader trend of your blood. That's what the hemoglobin A1C is measuring. And
That's
we
awesome.
we know it's a huge, blood glucose and genetics are all some of the main players when it comes to all types of conditions that we got to watch for.
What are some, why is that one important, Doc? Because that is typically on an annual panel. We're using it to screen for diabetes for a lot of folks, but in our thinking around this, hemoglobin A1C, that 3-month window of what your sugars have been doing, predicting mortality, how does that play a role in that?
Well, let's take it from kind of the other end of it. For instance, with diabetes, most people aren't going to die from the diabetes. It's the complications after it, right?
Yeah.
So we have the retinopathy, nephropathy in the kidneys, neuropathy. So what's the common theme with all those things? It's the tiniest little vessels that are directly getting impacted most. If there's too much sugar lingering in the blood, we know that the downstream metabolites of that are having a direct adverse impact on the lining of the blood vessels. Eventually, if the blood flow is compromised, then the surrounding nerves are compromised, right? Hence the example of like the neuropathy with diabetes. So it's more too much sugar in the blood. We know it impacts nerves and blood flow, but even our immune system, like, what is it, like 30 or 40 grams of sugar will decrease your overall immune resiliency, like by some ridiculous percentage for the next 4 to 6 hours.
Yeah.
So it's horrible.
Yeah, it is. I call sugar the white death, but we have this marker, the amount of, it's like, there's a lot of pounds of sugar now entering into our diet in the West, and that is definitely having negative consequence to our overall health, life expectancy, quality of health. All right, so we've got blood, glucose, and hemoglobin A1C. Homocysteine is another marker that we have in the blood.
Yeah. And homocysteine, it's one of those things, Dr. Eckel, where it's like, what is it going to tell us? It's one of those that's not going to be a linear, like, oh, it means you have this, right? But it's more of a really important indicator of, okay, there's some serious inflammation going on. And, anything like above 10 is like all-cause mortality, Alzheimer's, dementia, like the worst of the worst.
Ideally, we have this between 6 and 9.
Right.
Implicated, it's a specific marker for heart health. homocysteine gets kicked out of the Krebs cycles at the bottom. So why heart health? Well, this is a methylation pathway. It's a methylation marker. Mm-hmm. We started the show talking about DNA methylation and measuring the biologic age of our cells. Well, this is one of those markers. If it's elevated, one, you could have genetic SNPs, the single nucleopeptides, for methylation, which is very common. 677 and 1495 TT. I think that was the number. Yes, I'm getting now peptides mixed into my brain.
Polymorphic.
Either you're homozygous or heterozygous or have no issue with methylation. So homocysteine is the functional marker of that in the blood, in length. So that's one you definitely want to have in your panels. We also are looking at DHEAS, so sulfated DHEA.
Yeah, because you have the active and inactive one. So this is a more fun one and kind of more recent to the scene, where like sometimes in a hormone panel they check DHEA, but we can check DHEAS. Like, how is the body converting it? How is it using it in the blood? And it's a pretty decent predictor of bioage. I mean, we know it's going to be a little different for men and women, but I mean, we know just from the whole cascade of emotions, of hormones and the endocrine system, impacted by emotions for sure. But so from DHEA, we know eventually there's going to come testosterone and then the estrogens and that whole dance. So strong predictor of bioage. Men, I feel good if I see 350 to 500, right?
Okay.
And then women, maybe around 275 to 400. And there's natural ways to support that, right? There's a couple of different panels that we run, saliva, blood, or urine based, to check different hormones level.
Perfect.
Yeah.
So those are some of the big hitters as far as measurements, right? So if we're going to call aging a disease, we're going to live to be 150 years old with our brains and brawn and community, lots of love and support and abundance with grace and ease. We want to measure. So, there's objective data in the labs, in the blood, and then more functional medicine testing. And then we gave you a functional test of getting up and down from the ground. So these are really fun to play with. It's really great to explore. And it's also most important to know your numbers. So any other nuances to testing that we want to bring up here?
Wow. I mean, yeah, there's a lot. I mean, even another recent test that we were talking about, it's called Metabolomics Plus, right? Where it's like checking everything from like organic acids in the body and the blood, neurotransmitter metabolites, how they're interfacing with different hormone metabolites. So you can run all these like specific hormones or neurotransmitters, but when you see how it's kind of put together and how they're influencing each other, there's some really useful information in that.
Yeah, that's awesome. I guess I want to emphasize in this piece is you've got to ask the right questions to get the right answers. So, the Western thought process of the annual exam and some of the screenings are important, but man, it is antiquated because we've got some really exciting testing. I know I said exciting testing together. I totally am a geek and a nerd in this stuff. But to really dial in and push on what do these numbers mean, and actually in actuality, like move the needle for you, your quality of life, your energy, your zest, your ability to produce from your heart and access your creativity in the frontal lobe. So health, performance, longevity, there's all of these levers that we want to make sure you're checking those boxes, because it is, without our health, we don't have anything.
Right.
And why not get into thriving mode, which is, it's just a lot more fun. There's a lot more love. There's a lot more serendipity. There's more flow. There's more magic, right? I said magic on a science show. So all of these components all put together. So what do we do after we collect this data? Like, how do we assemble this for folks?
Well, if you start with the right questions and you see the patient where they're at and it's an individual, with a whole history and constellation of symptoms. If we get the right tests and we get the accurate numbers, from there we can figure out an individualized plan and program, right? And there's different ways to, like, checkpoints along the way. Are there nutritional deficiencies happening? Is there issues with the gut health? What's going on with the methylation pathways? Are there metals? Like what is it that's going on based on the symptom picture in the individual? Let's test and then correct it and then retest, just to be scientific about it, right? We know that some things can change pretty quickly and others take a few months. So reassessing and making sure that we're moving the right levers in the direction of health and positive change, really.
Love it.
Yeah, where the goal isn't just to eliminate the symptoms, because what is it? We know when we start seeing symptoms go away, we're only about 30, 40% there, right? Like, we want to make sure the symptoms are gone. Sure, that's just like the last case messenger of the body telling us something's wrong, but really going above and beyond and addressing the underlying causes to get to that 80, 90, 100% point where we can go from surviving to thriving.
Yeah.
Right?
Yeah. That's awesome. And then we also really talk about individualizing and tailoring programs to people, right? Because it's not there's no, we're all our own unique special snowflakes is what we would tell the kids of. You're actually not a special snowflake, but we all are different and unique. So really finding that path, the practitioners, providers, and evaluation that works for you, that turns over enough stones, but then most importantly, that gives you a specific game plan and program that then is measured through time to make sure that you're getting results, right? So that ultimately in the real world, I like to say I'm a clinician's clinician, is we want to make a difference. We want you to feel different. We want your markers to improve, of course, but ultimately we want you feeling better. We want you feeling better. So it's not one size fits all, and it's looking at these feedback loops so we can measure to then correct effective change.
Absolutely. Yeah. And I can't help but mention, so that snowflake idea, somebody mentioned how we're not just a single drop in the ocean, right? It's more like we're the entire ocean in a single drop.
Ooh.
Right?
Yes.
So there's so much to uncover. And
Doctor, you're making my head flip there. That's the you are in the universe is in you.
There you go.
And having that, that whole ocean in the drop, and you are the drop. So that's beautifully said. How do we know it's working?
Retesting, improvement, it's just, one thing is seeing symptoms get better and kind of seeing that the patient is actually experiencing life differently. But, there's a whole, if we're seeing them in person, even things like the pulse, the tongue, different physical exams, there's the fun doctory objective measures, but the labs too have to be telling of how we know that we're getting the results that we need. And I mean, in a funny way, sometimes after a few months or a year or so, if they stop showing up, and when they do, there's a big old smile and they're beaming light, and they have other friends or family that they've dragged in because they feel like we need to help them. That's always the best, right?
That is the best. Yeah.
Yeah. When we and they have done so well that they're in a good spot, and then they want to help all those around them.
Love it. Yeah. I think, do you feel better, right? Do you have more energy? Are you sleeping better? Are you pain-free and mobile? Are you motivated? Do you have a positive outlook on life? Do you see the future as being more bright and abundant? These components, I was having a discussion with a friend last night, and he said that he was no longer an optimist. And I consider myself a radical optimist, and not in a Pollyanna fashion. It is addressing injustices and, environmental toxicity, all of the ills and the suffering, but really choosing to come at it in a hopeful light, and not in a pessimistic, or, realism is a popular viewpoint these days. But I'm not going there with people, because ultimately, what I said and wound up with, like, yeah, I'm saying I want to live to be 150 years old. Well, guess what? If I don't make that, what do I care? I'm not going to be here anyways, right? Like, oh, I was wrong. Oh, well, big whoop, right?
Mm-hmm.
Like we have this component of like, well, we don't want to be wrong anymore. So like we can't change our minds or presented with the evidence and data, like, saving face, like you can't be wrong anymore. Like, come on, that's part of being human. Like we're mud people in it. So it's that piece of feeling better, good energy, ability to sleep. Like you feel incredible. Like these are our receptors. There's so much information we're not gathering with them. And really fine tuning and tuning into that and the nuances to like, really stopping to smell the roses, or, really feeling forgiveness for yourself and loved ones, like not just lip service, but actually experiencing it. I think I shared with Dr. Nadal, I went through a week-long meditation retreat, and I actually woke up into that statement, you are the universe is in you. I've been meditating 30 plus years. I've never experienced that. I've said that statement because it's a Chinese medicine adage. The sages through time have taught that. But to wake up in the eye of the universe is a literal star, as a star, right? Of acknowledging that's who we are, and you can actually exhibit and feel it in your cells. It's riveting. It's electric. It's enlivening, right? I'll see if I can find another E word. I love those adjectives, but it is. Say that again? Exhilarating. Yes. Enlightening. So it is, it is what I'm about promoting, putting out into this universe, into this world. For you all listening and viewing, thanks for coming on this trip with us. And, we do want to hear from you. So if you have questions, put them in to support@naturecuresclinic.com. So nature singular, cures with an S, clinic.com. We're going to answer them on the show. We're going to be impromptu sometimes. We're going to get a little loose. We're going to make it fun. Coming down the tail end here, we had a couple of lofty goals for today's show. So we really drove home the testing component, and we talked about blood and blood flow and the qualities of the blood and the healing properties of the blood that provide life force, energy, and health. So one of these biggest nutrients in there is oxygen. So I want to mention the role of oxygen in health. Now, we know, I don't recommend to stop breathing, right? Don't stop breathing. And oxygen is the source of life. Like our red blood cells are set up with 4 irons put together to allow oxygen to sit on that bus and be transported. Our cardiovascular system on oxygen carrying capacity that we can measure with VO2 Max. Oxygen is anti-inflammatory. It helps your body heal quicker. There's some theories in past times where there was a higher oxygen concentration on the planet where things grew much larger. So there are multiple ways that oxygen and oxygen therapies help our body. We do know don't stop breathing, because that's actually how you get carbon dioxide out, oxygen in. We have this great relationship with trees and plant matter where they take up carbon dioxide and breathe out oxygen, which is necessary for us. We breathe in oxygen, breathe out carbon dioxide to them. So let's talk about what oxygen does in the body and how does it help?
Wow. Yeah. So much. I mean, source of life, right? We know even in the evolution of the planet, there wasn't really a whole lot going on till enough plants took over to share with us and bestow higher levels of oxygen and allow us 4-limbed funny creatures to roam around, right? So, I mean, it's huge. Even I think yesterday we were talking about the significance of it. Like when you have a scuba diver, right? And they go up too quickly, and the ratios are off, and then the nitrogen offsets the red blood cells and they can't get enough oxygen. And it is so painful. It's intense.
Has that happened to you? Have you had that?
I've seen it happen to a buddy of mine. I was snorkeling, he was scuba diving. I was enjoying the bubbles coming up, and then I'm like, oh, what's going on? So
oh my gosh. Yeah. Wow.
Yeah, but it's intense, So it's clear that we really, really do need it. I mean, even just try holding your breath for more than a minute or two, right?
Oh yeah.
But we know reducing inflammation, increasing energy, and this is cascading everywhere from our blood vessels to our nerves, everything, all the way down to within the cell. Within the cell, we have the mitochondria, right? The energy kind of workhorse in the cell. And along the little walls of the mitochondria, we have this fun little train called the electron transport chain, right? I called it a train. It's a chain, but you get what I'm saying.
Yes.
So it generates energy in that. I mean, sure, we need a lot of different essential nutrients and vitamins to keep that going. But without oxygen, there is no show. That's just not going to work. So from the body systems to all the way down to the cell and the cells within the cell. We need to be saturated in oxygen.
Yeah, all of those levels are so important. And then we do have, there's oxygen therapies that we can employ here.
Mm-hmm.
Hyperbaric oxygen therapy, ozone therapy. We have EBOO coming, extracorporeal blood ozonation and oxygenation therapy, which is 400% more potent than ozone therapy. Ozone is O3, so there's one component of oxygen gets cleaved off, takes care of any free radicals, bacteria, viruses, molds, rids the body of that. Then you have this nice oxygen to feed the body, which is anti-inflammatory, nutritive to the system. Exercise does increase volume capacity of oxygen, carrying capacity of the body. And then you so eloquently laid it out from macro to micro and back. So it is, we're doing some really interesting therapies with oxygen. We call it in hyperbaric land time in the tank. We've got 2 chambers here at the clinic in Portland, and we have 2 chambers in the clinic in Park City. And it is, it's kind of that elixir that you can put in that will help when we talked about the measurements of aging. It will slow down aging. It will decrease the inflammatory cascade, which is a quick aging agent. It helps your immune system. So, it's a very high grade intervention for folks. You can get too much oxygen. It's called oxygen toxicity. So there's only so many hours that you should safely stay in a tank. I'll stay on the hyperbaric front. LeBron James trains with the hyperbaric chamber. He takes it on the road with him. LeBron James has played more hours in the NBA than any other NBA player in history. He still has he's one of the best trained athletes on the planet. No injuries or chronic injuries that are reported. Maybe he has some that we don't know about, but he does. I've studied his rehab, his training, his trainer, some great interviews out there with them talking about what they do to keep his body in tip-top shape. And we can take notes from the athletes and bring that down to us mere mortals, right? And use those best things of folks that are really pushing their bodies. But how do we keep our bodies up in tip-top shape and functioning? It is this use it or lose it type of scenario. Mm-hmm. Anything else on the oxygen front that you'd like to add?
No, I mean, it's solid. We can get into the nuanced details on how it's helping inflammation and our immune system and all that. But I think the main points are there,
Excellent. I did want to mention one study that came out of Tel Aviv University. It showed HBOT could stop the effects of aging on red blood cells in healthy adults and reverse the aging process. This is printed in the literature, reversing the aging process. Mm-hmm. In a biological sense, adults' blood cells actually grew younger. So it increases stem cell production, your own stem cells, which are repair mechanisms. So it is, we've got some great research, 30, 40 years of research. There's the Oxygen Revolution by Dr. Paul Harsh out of Louisiana. He's done a ton of research. In that book, he's got prescriptions for all kinds of disease processes. We utilize it here really around brain regeneration, healing of wounds, top performance, brain health, really. Oh, and I forgot to mention, so off the hyperbaric front, but EWOT, exercising with oxygen therapy. So this is breathing higher levels of oxygen during exercise will increase your strength, endurance, and stamina. So that's breathing. Again, don't try this at home, folks. Do it under the guidance of a skilled provider because you can get oxygen toxicity. So it means you can go longer with greater power with more oxygen carrying capacity in your body. More effective workout in the same time frame. In addition to that, the body operates better when your blood is oxygen rich, right? It's anti-inflammatory. It's feeding the cells for energy production, the electron chain transport, chain, say it in the right direction, choo-choo. So that is a piece of the puzzle here on oxygen. So, again, we're singing the praises of oxygen. Remember, don't stop breathing. It's important. And, we got to get the measurements done. You got to get your body moving, and you can add in some oxygen therapies too.
Excellent. And what's coming up for next week, Dr. Eckel?
Well, let's see. We're going to talk mitochondria. We're going to talk about those little kidney bean shaped organelles in the body. We're going to talk about performance. We're going to talk about different therapeutics you can do to increase your mitochondrial functions, like intermittent fasting, ketogenic diet, caloric restriction, cold exposure, different supplements we're going to cover. We're going to talk about, does environment matter? Are we, what do we do about that? Like we're not just connected up here in our brains, we're living in this beautiful heavenly space if we can see it. We're going to talk about that. We're going to talk about NAD, which is the darling child of the longevity movement now. And then also diet. We're going to talk diet. So to be a little bit more practical, I know today was a little heady in the science and measurements, but really important laying this groundwork going forward. So everybody, thank you for tuning in. If you enjoyed the show, let's give us a 5-star review. Tell us what you learned because those reviews matter. Share us with friends and family. We'd love to take them on the ride with us because we want to age well with our brains and with our brawn and with our community. That's you. We wouldn't be doing it without you. So thanks again, everybody. Dr. Greg Eckel.
Dr. Jonathan Nadal.
This is What the Health, and we are here on the Contact Talk Radio on Tuesdays from 2 to 3 p.m. Pacific. Tune in next week for another riveting episode.